Health, a practicing physician. He joins us tonight to tell us. Hey, doctor.
Tucker, last night I talked to you about the devastating effects this virus can have on the body. Now, a lot of research is going on, a race against time, to try to prevent the virus from spreading, from propagating, and also from causing that inflammatory response that I talked about. One drug that's been looked at very seriously and is emerging from clinical trials, you just mentioned, remdesivir, that drug is showing some promise. That's an antiviral drug. Now, today I talked to the person we call the general, Dr. Dan Sturman. He's the head of pulmonary and critical care medicine at NYU Langone Health, and he's also in charge of 2 trials at NYU, and they're studying several drugs at the same time. The goal is to beat the race against time with all the science we have. Let's watch Dr. Sturman.
We're currently conducting a number of very important clinical trials. Some of these trials involve novel antiviral agents like remdesivir, which is a very potent antiviral agent originally developed for Ebola. Other important interventions that we're studying the role of hydroxychloroquine, the role of convalescent plasma, and many other agents that we believe may be involved in the pathophysiology of COVID-19.
Tucker, when we emerge from the clinical trials on remdesivir, and we're hearing from several sources that it's promising, the real question is going to be when to give it, how early to give it, because you have to give it before all of these devastating effects like blood clotting, like inflammation, all of the things that are jeopardizing the patient's life occur. That's going to be the art of medicine. Right now, we're dealing with the science of medicine, and what's really amazing here is, by the way, Dr. Sturman actually recovered from COVID-19 himself and then went back to the fight. That's what's happening. Scientists on the front line fighting this virus, figuring out in real time how to treat it. Remdesivir being one, several others, anti-inflammatory agents, blood thinners, several different tries, hydroxychloroquine. We're going to find a way to really ameliorate the symptoms here, and we're going to beat this thing, Tucker.
How far are we from applying this to the average person? Very quickly, if you get sick, you wind up in the hospital, are you likely to be treated with this?
This is clinical trials all across the country, so it's very likely you're going to, if you're in a major medical center, this is something that may very well be tried. It's going to be emerging from clinical trials quite soon. It's promising. I think in a matter of weeks, maybe a month, you're going to see it available for use. This or something like it. This is a very potent drug, remdesivir, and I think it's very promising to decrease severe symptoms in very threatening cases. We heard that from Dr. Khalil in Nebraska, who's in charge of all of these studies for remdesivir.
Yes.
And we're going to see the clinical trials soon. Very promising drug.
Dr. Siegel, night after night, your updates have been fantastic. We appreciate it.